Okay, hi, my name is Phil, and today we'll be going over different cranial nerve exercises. And today we'll be starting with the extraocular muscle movements. And we'll be going over 3 different cranial nerves with this one exercise. And the first one being the abducens nerve, and that's going to be cranial nerve 6. And this is in charge of the lateral rectus muscle in your eyes, and it moves your eyes laterally. And these next two are the nerves deriving from the midbrain, to be your cranial nerve 4, which is your trochlear nerve, and this is in charge of your superior oblique muscle. That's going to be moving your eyes down when looking towards your nose on either side, and also rotates the eye internally. And lastly, we're going over cranial nerve 3, which is the ocular motor nerve, and this is in charge of all other muscles of the eye, and also raises the eyelids and mediates pupillary constriction. So I'm going to be going over this with the patient, and basically I'm going to hold my finger in front of her face. She's going to hold her gaze at my finger, and I'm going to be moving fingers at an H pattern, and I'm going to take her through all 6 cardinal directions of gaze. So I'm going to hold my finger right in front of her here. Okay, and then just go ahead and follow my finger. Go laterally, up, down, follow it this way, up, okay, down. Here we simulated all 3 of those cranial nerves, and looks like she's doing good. Okay, next we'll be going over the auditory acuity exercise, and that's going to be assessing cranial nerve 8, that is the vestibulocochlear nerve, and this nerve is a nerve of the ear, and it's going to be in charge of sending information from the inner ear into the brain. This information usually includes sound information as well as equilibrium information. And to test the nerve out, I'm going to be asking the patient to occlude the ear on one side, and so to isolate one ear, and I'm going to be creating a sound sensation, and I'm going to be assessing both sides, and we're going to see if she hears the sensation and then also hears it evenly on both sides. Okay. All right, so I'm just gonna have you cover your left ear for me. All right, so I'm gonna be making a sound with my fingers just like this, and we're holding it 1 foot away from your right ear, and you're just going to let me know if you hear it fine, okay? Do you?
Yeah.
Okay, go ahead and switch. I'm making the same 1 foot away from this side, and just let me know if you hear it.
Yeah.
Okay, do you feel like you hear it the same on both sides?
Yeah.
Okay, now let's do it again. This time we're going to do it 2 feet away, so yeah, cover that side. All right, and
Yeah.
okay, and here.
Yeah.
Okay, and you feel like you hear it both the same?
Mm-hmm.
All right, that's that. All right, now we'll be going over a tongue assessment, and this is going to be assessing the cranial nerve 12, which is the hypoglossal nerve. And the hypoglossal nerve is innervates the most of the extrinsic and intrinsic muscles of the tongue, and we're going to be assessing by having the patient just stick their tongue out, and we're going to check it for symmetry. Okay, patient, let's go ahead and just stick your tongue out. All right, just hold it there. And we're looking for a nice symmetrical outward tongue. You can go and close it. Okay, if the tongue was deviating towards the right, that might indicate hypoglossal nerve lesion. Likewise, if it was deviating towards the left, it would be an indication of a left hypoglossal nerve lesion. All right, thank you. All right, next we'll be going over the cranial nerve 5, and that's the trigeminal nerve. The trigeminal nerve is actually a large nerve, and it has a very large network. And so it's divided into 3 divisions, and that's going to be the ophthalmic nerve, the maxillary nerve, and the mandibular nerve. And it's going to be in charge of the face, like basically your different areas of your face, and it's going to be the sensation. That's the sensory part, and motor would be the muscles of mastication, mainly the muscles around the TMJ, as well as the jaw jerk reflex. Today we're just going to be going over the facial sensation. So what we're going to do is I'm going to take this little wisp of cotton here, and I'm going to be having the patient close their eyes. So I'm going to close your eyes, and I'm going to be applying a sensation on both sides. I'm going to start on the right side here, and I'm going to be applying sensation first on the right here, just the ophthalmic. And do you feel any pain there? Right? And you felt that though, right?
Mm-hmm.
Okay. Next we do maxillary. All right. Pain, numbness. All right. But you felt that, right?
Mm-hmm.
Okay. Here. Mandibular. All right. Do you feel that?
Yes.
Okay. Pain, numbness.
No.
All right. And do this side.
No pain.
No pain. And did it feel the same as the other side?
Mm-hmm.
Okay. And this side, I'm gonna do both again, just so you can compare the two. Okay. And I feel the same.
Mm-hmm.
Okay. And mandibular again. Feel the same.
Mm-hmm.
Any pain or numbness? All right. So that's that. All right. Next, we'll be going over cranial nerve 5. That is the facial nerve. And the facial nerve is both a sensory and a motor nerve. The sensory portion would be in charge of taste, and the motor portion would be in charge of the muscles that create facial expression on the face. And I'm going to be asking the patient to do just a series of facial expressions for me. I'm going to be looking for just symmetry and overall ability to make those facial expressions. Okay, so patient, can I have you just raise both your eyebrows? Okay, bring them down. And just go ahead and frown for me. Frown, okay. That looks good. And go ahead and smile. All right, smile with teeth, big smile. Okay. And go ahead and puff your cheeks out for me. All right, and go ahead and just clench and flex your neck. Okay, and next I'm going to be assessing your orbiculus oculi muscle. So basically I'm going to have you close both your eyes, and what I'm going to just do is I'm going to lightly try to pull both your eyelids up, and you're just going to resist it and just keep your eyes closed, okay? All right. Resist it. Okay. Resist it. Okay. All right. Looks like our biggest oculi muscles are strong on both sides. Okay. Lastly, we'll be going over some accessory muscle strength exercises, and that's obviously assessing the cranial nerve 9, the accessory nerve, and today we'll be assessing two muscles, the trapezius muscle and the sternocleidomastoid muscle. So we're going to be starting over here with our patient. Okay, patient, go ahead and scoot up a little bit. All right, so I'm going to be pressing down on your shoulder. I just want you to do a shrug. So let's go ahead and do a shrug right now, and then just get to resist me on the side, okay? So go ahead and resist. 5 seconds. 1, 2, 3, 4, 5. Okay, grade that a 5 out of 5. I'm going to do the same for the other side. Okay, go ahead and shrug, yep. And 1, 2, 3, 4, 5. Okay, again, I'm going to give that a 5 out of 5. And next, I'm going to be assessing the sternocleidomastoid muscle. So let's go ahead and turn your head to the right. Okay, and I'm just going to be contacting right here on your chin. I'm going to be trying to push you towards the center, and just go ahead and resist it, okay? All right. Okay. All right. And I'm assessing the left sternocleidomastoid, the contralateral side. That's a grade 5 out of 5 for that side. And we do this side. Okay, and all right. 2, 3, 4, 5. Okay, and that's gonna be a grade 5 out of 5. And that's gonna conclude this video. Thanks for watching. Like, comment, and subscribe.